And now, without further delay, let's begin today's event, sponsored by HSA Bank and hosted by Employee Benefit News and Employee Benefit Advisor. I would like to introduce your moderator for today, and that is Lynn Gresham, freelance writer and former editor-in-chief for Employee Benefit News. Lynn, you have the floor.
Thanks very much, Adam. Good day, everyone. We're pleased to have you with us for this web seminar, Improving Health and Wealth Engagement in Our Changing Times. The COVID-19 pandemic has us all focused on how to stay healthy and financially sound in the short term, but what about the long term? As you'll learn in today's seminar, too many people are not thinking about their future health and financial well-being, and they may not be taking full advantages of the benefits you're offering them. For employers, this represents both a challenge and an opportunity to rethink how to help and engage employees. Here to share important research on this subject and offer solutions is our featured speaker, Kevin Robertson, Chief Revenue Officer with HSA Bank. Kevin has nearly 25 years of experience in employee benefits, insurance, and financial services. For more than a decade, he has been exclusively focused on the consumer-directed healthcare industry. He serves on the Healthcare Trend Institute's editorial advisory board and is a board member and compliance committee chairman of the American Bankers Association HSA Council. The HSA Council is the largest trade association and lobbying association on behalf of the HSA industry, and Kevin spends time in Washington working on legislative and regulatory affairs. Kevin's tenure with HSA Bank spans 14 years. HSA Bank is a trusted leader in the consumer-directed healthcare industry with over 20 years of experience. The company empowers consumers to make the most of their healthcare dollars by providing health benefit solutions that include health savings accounts, flexible spending accounts, health reimbursement arrangements, commuter benefits, COBRA administration, and HSA investment solutions such as HSA Advisor Plus. It currently serves 3 million members and more than 35,000 employer groups. Now I'd like to turn the program over to Kevin.
Thank you very much, Lynn. It is always a pleasure to be with you. I know we've been doing these for many years now, and it's especially great to be with this audience once again. And I'm just thinking about this earlier as I was prepping for the webinar today that, given the pandemic times, having a webinar break is honestly a welcome addition to the day and provides us some semblance of normalcy as well. And again, the topic we're going to talk about today is health and wealth engagement, and this is really a topic that we have been deeply involved in for years. We've spoken with this audience and written about this many times. And as a reminder, the genesis for today's presentation really is the concept of engagement in health and wealth, and it coincides with the recent release of our third annual Health and Wealth Index study. So why don't we take a look at the information that we're going to explore today, and it really is going to start with why and how health and wealth engagement is key to our preparation both for current and healthcare needs, especially in retirement. And we're trying to lump this into three different categories of topics that we'll dive into. First is kind of exploring the different needs of demographics, looking at some data insights that we have collected over this year and previous years with the release of our index study. We'll also have specific insights into the engagement and how to lever that, and ultimately turn that into an answer a question. Well, what can employers do with this information? So why don't we get started? And, again, given the circumstances of the current pandemic and how it's really impacted the entire landscape of healthcare, and the economy, I would be remiss if we didn't start there. And what I would like to characterize the discussion was really to understand what's honestly becoming our new norm. And COVID-19 has already infected, and these are the most recent numbers I pulled off of CDC websites this morning, but just in America alone, it's impacted a little bit about 4.5 million Americans that have been infected, and unfortunately it resulted in more than 150,000 deaths. On the infection side, that's about 1.3% of your population in America. But beyond those terrible numbers, as bad as those are, every American, I would argue, has been impacted, whether it be from the reality of the pandemic itself the related components of this, or just simply the change to life. And if you look at what this has caused, it's created widespread uncertainty about the future, and tied to that very closely is a renewed sense of apprehension. And it is fear, right? It's fear of the unknown, fear of the pandemic, fear of economic realities, whatever it may be. It's led to probably the most radically changed work norms in our lifetimes, and the swiftness at which that change came was very impactful. Now, it's also impacted how we care for our family and ourselves, and we may have employees that are caring for ill loved ones or whatever the circumstances may be, or quite simply just having to take care of children unexpectedly. And it's also created a big impact in how we are interacting with our health care. We saw a huge postponement of medical appointments and treatments simply because they couldn't have those procedures unless they were of dire circumstances for months. And so we're starting to see this slightly open up. And we can see that there's a lot of worry about all of these things, even in the data. We'll talk a little bit more of these insights in just a minute, but one of the data points that jumped off the page when I was looking at the results of the index is that 52% of consumers said that they frequently or occasionally worry about current and future medical bills. I think that's a really important component, and I expect that number to go up just because of, as the pandemic goes on and the related economic impacts go on, undoubtedly these new norm feelings are probably going to become stronger. However, if there was a bright side to the pandemic, you always have to find the bright side in everything, it's probably that it has creating a higher awareness and renewed interest in healthcare and health engagement. And I think that gives an opportunity for employers, because after all, employers have tried for years to use other levers, usually around economics, to create an inflection point where people would actually engage with their healthcare at a point where they still had runway to do something about it. The bottom line of my point is that, guess what? We have a captive audience right now, more captive, and again, it's as a result of the pandemic, probably more captive than we had in the past. So as we look to, moving forward, what does this tell us that we can do? Quite simply, everyone, whether it be employees, employers, young, old, doesn't matter, on the entire spectrum, we all need to pay more attention to our health and financial well-being. The question really comes down to how, and that's what we're going to talk about today. First, getting more insights on employee health and wealth engagement, and then some ideas that you might want to consider and opportunities that you may want to utilize for driving engagement within your employee population. So let's actually get started. I have to give a little bit of background because I can't assume that everyone on this call has seen our previous research on this. We at HSA Bank in 2017 launched a function called Health and Wealth Index. And the beginning, the genesis for the Health and Wealth Index was a request by our employers and individuals that understood the concept around health and financial wellness and this idea of engagement in that, but they lacked really the tools to understand that engagement and how to make it actionable. So that's really where we spent a long time taking a research-driven approach to creation of the Health and Wealth Index. And that generated not only the actual scoring mechanism, which I'll talk about in a second, but also the research behind it. And we have now published, this is our third continuous year that we've published insights on these, providing not only baseline information so that employers or individuals could compare any of their own results against, but also provides some type of a insight in terms of the data that we're seeing across a broad cross-section of Americans. And that is really what we're going to spend a lot of our time on today, but I needed to explain some of the background of Health and Wealth Index in case you haven't seen some of our previous research on that. Now, on the index itself, the methodology, and we've employed now for the same consistent methodology over the last couple of years, is that we interview a broad cross-section of American adults. We actually don't do it ourselves. We go to a professional research organization to be able to do it. We want to take as close a true scientific approach to this as we can. And we interview them to get insights about not only their health and wealth engagement score, but also asking different questions about their practices and ability to pay for healthcare expenses and so on and so forth. Now, the maximum score of the index itself is 100. Now, that would be probably meaningless unless you had a comparison, so I'll explain a little bit more about the methodology there. The one thing I want to make sure to reiterate, though, is that this is not measuring a individual's actual health or actual wealth. That's not what it's measuring, but instead their engagement. How deeply are they concerned and are taking action on these things? So it's an important distinction that we're not talking about actual health and actual wealth, but rather that engagement component. When we looked at all of the data and stacked it up in terms of where people kind of fell, what we found was that people fell into really one of four categories of consumer engagement. First, the minimally engaged, and these are the lower score ranges from 0 to 39. These are people that probably have a fairly low engagement in both health and wealth, whereas the next category, moderately engaged, probably have a deeper engagement in maybe one of the two areas. The highly engaged, the level 3, would be 60 to 74, for example. Now we start seeing people that are fairly engaged in both health and wealth. And then optimally engaged, the people that score 75 to 100, we would see that they typically are highly engaged in both health and wealth. If I were to look at the breakdown of scores, and we've looked at this using pie charts and kind of bell curves, and if we were to put it on a bell curve, you definitely see that a lot of people that score somewhat in the middle ranges. But it might be easier to look at this on a pie chart. And the good news here is that the average score is 56.4. So if you were to think about where that places the average, it's towards the higher end of the moderately engaged column. But there's a little bit, I'll call it bad news if there is, that means we still have a long way to go, because nearly 60% of people, tend to be in the lower ranges if you look at the percentages that are in the minimally engaged as well as the moderately engaged category. Another thing that you may or may not recognize if you remember our past research on this is that our score fell this year. It was 62.3. It has fallen down to 56.4. And again, it's not necessarily to be alarmed. Quite honestly, when you have a sample size of several thousand, it could just be the luck of the draw, if that makes sense. But we definitely saw a dropping, and perhaps that might be leading indicators of the impact of COVID. Again, we don't know exactly the reasons why it fell a little bit, but it had fallen just a little bit. Now, the component of this that I think is important to remember about health and wealth engagement, and I would say why this continues to lag, because this isn't something that's a new concept. This is something that we have been talking about and the industry's been talking about for several years. And quite simply, my hypothesis around this is that health and wealth engagement isn't fun. It isn't sexy. No one likes to think about this, and even less people like to take action on it. It's just like, physical well-being and health and working out. People don't necessarily like to talk about working out or the need to work out, and fewer people probably do it with regularity, but that's all the more reason we should, talk about this and raise the awareness. And this also impacts employers directly. And we've actually given previous research that I'm sure you can find through the EBA-EBN website or on our website, talking about why this matters to employers and how this impacts the employer's direct bottom line, because health and wealth engagement is one component of overall employee engagement and satisfaction with jobs. So that's really where we're going to focus our efforts today. Now, we've mentioned before that we're going to have a few interactive polls, and we've reached that first poll question, and we're going to try and gain some insights into our audience here. So I'm actually going to ask if I can turn it over to Lynn, our moderator, for a minute to take us through the first poll question. Lynn?
Thanks, Kevin. What we'd like your feedback on is the first question: how often are you engaging your employees on their health and financial wellness? The answer choices are not yet, just starting to engage employees, you're moderately engaging them, or you're highly engaged. They are highly engaged right now. Be sure when you give your answer to hit the submit button in the lower right. We'll give it a few more seconds for the results to tally. Let's see what the audience says. 52.6% say moderately engaging, another 12% are highly engaged, which is good, and 26% are just starting to engage. Only 8% said not yet. So that looks very promising. Kevin, what do you think?
Yeah, absolutely. I take this as a great positive, and I can tell you again, we don't have the trend information right here, but when I've asked this of all these numbers are higher than that. So I'm going to take that as a early indication that we're moving in the right direction, and employers really understand the value and are looking for ways to engage their employees. And that's really what we're going to talk about today. So that's excellent. Well, let's actually get going and kind of take a look and dive into the actual data itself. Now, there's lots of insights that we have in the white paper. Time, unfortunately, doesn't allow us to dive into every single aspect. So what we've tried to do is pick out the most impactful or most insightful components, not only to learn what those things are and what they tell us, but then also to create that and turn that into some way of taking action. So the first interesting component is something that we noticed in the generational engagement. One of the things that we did this year is break the younger age responders into Gen Zs and millennials. So our Gen Z definition is 18 to 24, and our millennial population was the 25 to 39 component. And we found, surprisingly, honestly, that the Gen Z population actually were the most engaged. And we're going to dive into the Gen Z population in just a little bit later, but I was definitely surprised by that. But you're going to find in a second that while they scored well, there were still some big gaps on a couple things. On the inverse of the Gen Zs were the Gen Xers. I happen to be a Gen Xer, and so I'll throw myself under the bus here as well. We were definitely the lowest this year. We were 54.4 average engagement score. You know, and again, you could hypothesize why it is or not. My own take on this is that, you know, quite honestly, Gen Xers likely have the least time on their hands. They generally, based on age and family and just societal norms right now, they tend to be a pretty busy group. And quite honestly, we tend to be very independent. We were definitely the generation of kind of go it alone, you know, raised in front of the television type population. And so I think it's a generational component of that we probably are so busy we're not taking time to engage with this, whereas, you know, for instance, the millennials and Gen Zs are definitely more in tune with their health and engage differently there. While the Gen Zs, though, were the most engaged, ironically, they actually have the most to learn about some components, important components about what constitutes engagement in health and wealth. For instance, in health plan cost knowledge by age, we ask questions based on, you know, people's understanding on basic concepts of health plan costs. So things such as deductibles and premiums and co-insurance and so on and so forth. And if you were to look, you know, Gen Zs and their basic knowledge, Gen Zs had the lowest knowledge in these components. You can probably guess as to why, and I would probably chalk it up to one of two things or both. Number one would be that they have had the shortest amount of time working with inside of their health plan, so maybe they haven't been exposed to some of these things, and especially because generally the younger you are, the healthier you are, or the less healthcare consuming you're doing at that particular time, so maybe they just haven't had the utilization. Also, there could be a factor we'll talk about a little bit later about, many of them may be on their parents' coverage and not exposed to some of these things because they're taking advantage of the 2H26 capabilities under the Affordable Care Act. Now, we continue to see that year after year, the strongest factor of engagement, if we were to look at all the different demographic pieces, and we've done, again, previous research, whether it's age, education, marital status, sex, whatever it may be, we continue to see that the strongest correlation of factor to the score is their health plan type, and HDHP, or high deductible health plans, still continue to lead the pack. Now, we did see this year a pretty across the board slightly lower scores for traditional plans. So for instance, HDHP last year was 68.2, PPO fell considerably, it was at 66.6, and HMO fell slightly from 63.6 down to 58.6. On the inverse of that, actually, the scoring for the public components of insurance, Medicare and Medicaid, those are actually slightly improved over last year. So again, the question as we look to future years is, will that trend continue? Now, again, looking at that same comparative analysis we were just talking about in terms of their health plan cost knowledge by plan type, this tells us as an employer, for instance, and again, all employers have faced the same challenge, is trying to figure out where they're going to put their focus with regard to education. Now, we'll talk about some more tactical things you can do to target education in just a few slides. But if you were to look, it's pretty universal that even common concepts around things like deductible and copay. I mean, these are front-end costs. If you think about it, the understanding level, still remains low, and it's not just the back-end costs, such as obviously a coinsurance or out-of-pocket maximum. Probably the most surprising number on here, the one that honestly universally applies to anybody with health plan coverage, is that more than 50% of the population do not know what their monthly premium is. So when you can't even, it's a very critical component of understanding how to help engage people, and knowing and understanding is half the battle to get started. And if they don't know what their premium is, how could we ever expect them to know things like copay and deductible and eventually coinsurance and out-of-pocket maximum? So again, even the basic elements of understanding sometimes go and are missed. Another component that we looked at a little bit more deeply this year was engagement by gender and marital status. Kind of a couple interesting tweaks here of, the last couple of years we saw that women scored slightly better than men, and we actually saw and it's a minimal, somewhat de minimis difference, but we actually did see that flip this year. So the total number, the total scoring was similar to last year, but we, for the first time, happened to see a score where the men were doing a little bit better than the women. On the marriage side, we definitely continued to see a little bit different score between single and married. We had very comparable scoring in the health side, the wealth side, and again, they're color-coded, so the health is the light green, and the kind of dark green / aqua color would be the wealth score, and we continued to see married folks have a slightly higher score there, and it's probably because the likelihood of having two incomes in the household is probably higher, and that often affords ability to maybe take a different approach to your wealth engagement. So now let's dig in a little bit into the insights to find the underlying challenges. Now that we've seen the data, what do we think is driving some of these components? Now, we look every year when we do our research here, we look for the major themes so that we can provide insights to employers to target on. And this year was really no different. That first of all, consumers, as we were just talking about, are very unfamiliar with important aspects of their health plan. And because that interaction is health plan, even those basic components really have to be reinforced and understood. Otherwise, how can you get people to think and act differently about how they engage potentially with their health plan? Financial best practices continue to be poor, especially for those nearing or in retirement. We've got a couple ideas how we can attack that very aggressively for employers to consider. And quite honestly, consumers are less confident in their ability to manage their health needs. And these are similar themes to what we've seen each year. I don't see anything that's surprising on here, so let's turn our attention to talking about what we may be able to do that. Now, the first one, again, how unfamiliar people may be with aspects of their health plan, despite, I'll call, the best efforts of the insurance community and employers and administrators to try and get people to understand these things. They just don't know some of the basics. And, even one example, again, obviously at HSA Bank, one of our primary products is an HSA, so I'll frame it up under the HSA population because we're in this business. Even what we see, people just don't understand whether their plan is HSA eligible. And, these aspects, greatly impact actual health and utilization and as well as their future savings. So let's dissect that a little bit more. This is really, and when I'm looking at knowing the costs, I like to chalk this up to calling it as making smart healthcare decisions. And those smart healthcare decisions are both current in terms of your utilization, and then I will call it the future preparation. We all know that we're going to need a lot of money in retirement. We all know that we're probably going to have an increased health challenge later in life. But what do we do about that? And again, the most interesting component here is I still am shocked by how few people know, even what their monthly premium is, because again, unlike everything else on the screen, that's a guaranteed expense that you're going to have every single month in and month out. Now, the second challenge was, again, around financial practices being poor, and again, similar to previous years. And I would say that this is because people. We've reported previously that about 40% of folks have reported that they never save for future health care expenses. This year we wanted to pull out the number of 37% of consumers reported, and these are 37% of consumers over age 65, that they rarely save money for future health care expenses. So even the folks that, and we know broadly all folks aren't saving enough for their future health care needs, but the people that are probably closest to needing those still don't do it. Again, a little bit better than the norms, but these are more than a third of those people age 65 and older rarely save for those healthcare expenses. And I'll be honest, the reality is harsh because 83% of those over 65 reported worrying about current or future medical bills. So it's not like they don't have a care in the world and they're not doing it because they don't care about this. No, they do, right? And 76% of baby boomers are not enrolled in a health plan cite costs as their primary reason. So with many of these folks either entering into retirement or in retirement, there's clearly a lot of a best practice of financial preparation for health care that's just not happening. Looking to, again, the factors, the driver, it really is all about those costs and money. However, when we look at income levels, what we have seen here is that, even the higher income levels have, similar difficulty with affording coverage. So I'm not going to say that income doesn't matter, but I would say that income is not as relevant as you would think it would be, because even higher wage earners, people with very healthy incomes, over $100,000, still report that same challenge. And I would say that these issues exacerbate as we get older, especially if we're not prepared for that looming expense in retirement. The third component we talked about or want to dissect a little bit was, again, that consumers were less confident in their ability to manage their health needs. And this answer, this leads to the answers like, for instance, 52% of consumers said that they frequently or occasionally worry about current or future medical bills. So this is, as you can tell, broad unsurety, and yet only 15% of respondents say that they frequently save money specifically for health care expenses. So, people are worried, they are not prepared, and they're not doing much about it. It probably won't come as much of a surprise here, but then the answer to the most employers in the room are saying, well, is this really my problem or not? An interesting stat I'll throw out there, and this actually came from a survey, a 2019 survey by the National Business Group on Health, that reported that 1 in 3 employees specifically wanted their employer to help them improve financial health. This is, again, one of those areas that they're looking to employers, whether we like it or not, and look at whether we have a paternalistic view on our employee benefits and engaging in financial health. It's something that they are looking for, and it's something that they desperately need. So undoubtedly, the desire is there. They also report that they're not very confident in different aspects of physical health and healthcare needs. In fact, 82% of respondents reported that they want to make improvements in their health and wealth, but yet only 21% of those have actually take action. So here's my ask for the employers. We see that, but we don't see the action. And I think what we need to do is figure out what are some ways that we can nudge them. And we'll talk about those ways in just a second, but we have reached yet another point in our presentation where we'd actually turn it over to Lynn to ask another poll question.
Okay, thanks, Kevin. What are your employees most interested in learning more about? Do you think it's improving health and wellness habits, health plan features and benefits, or saving for future health expenses? Please select the answer that best corresponds with your situation and hit the submit button. Well, we've got 60% who say health plan features and benefits. That's far and away the most, followed by just about 27% say improving health and wellness habits is what employees are most interested in. And only 13% feel it's saving for future health expenses, which corresponds with everything we've learned today. So, Kevin, will you pick it back up?
Yeah, absolutely, Lynn. And, it's funny because I would venture to guess if I put a all of the above option in that poll, it'd probably be the overwhelming favorite, because the reality is it's probably all of these things, right? Health and wealth engagement transcends these. I would say that for sure, and it does not surprise me that the employer population on the phone would probably lean more towards the health plan features and benefits, because that's probably the thing that we're most used to communicating and talking about, and probably have the most experience. And on the flip side, saving for future health expenses is probably the lowest. So really no surprises there, but it definitely, my point in asking this question is it really is all three. And the other thing that I'd like to ask people to consider is again, the future healthcare expenses is really the greater economic need, and it's the thing that if we don't take action on early, we can't use the time value of money, which we'll talk about a little bit later. So just keep that in the back of your mind as we start exploring and turning our attention to some of the things that we can actually do about these things to help employees. So let's do that. Let's close out the rest of the presentation talking about those opportunities. And there's three important areas that we'd like to potentially help give a nudge to our employees. The first is again, addressing helping employees understand aspects of their health plan, and the second was helping them confidently save, and the third thing was embracing preventative services, because this will help address really the three things we just talked about: current health and wealth, their understanding level, how to deepen that understanding level, and then of course help them save for the future. So let's look at some specific recommendations. The first, again, was helping them understand those aspects of their health plan. And the important message that I'm going to talk about here is it's not about, the important thing is not to focus on the topics you teach, but rather how you connect the learning to their world. Because you really have to look at your employee demographics. And I'm going to give you an example in 1 minute of what I'm talking about, because your employee population is different. It's unique. And there are components that you have to personalize, or at least think about how it's going to be consumed and viewed differently to be able to maximize your effectiveness, because you're going to find you can't take a one-size approach with things. You also have to try and personalize this as best you can. Think about how your employees, live their lives. And then when you deliver these things, you have to reinforce. This is a topic that we've talked about several times, and I know we had a great, well-attended webinar we hosted with EBA-ABN last October that talked about the ideal engagement approach, and I encourage you guys, if you haven't looked at that, you can download that information, access that information, because it really reinforces how you can drive continuous improvements in engagement and continuous progression. But let's take a little example. Let's take a look at that Gen Z population we were talking about, right? So this is the ones that they had a higher average engagement, but yet they knew the least. Well, what's probably driving this? Well, first of all, I think it's important to remember that these folks grew up in the era of the Fitbit, right? So they lived and have pretty much never known a world that didn't, revolve around smartphones and smart devices, right? And their familiarity with, for instance, I'll use Fitbit for example. Their familiarity with the health tracking helps facilitate their learning. A Fitbit there's nothing magical about a Fitbit. The Fitbit or other health monitors like that, it's just simply a tool to help facilitate something. It may serve as a reminder, an engagement tool. It's just a method to the learning. This tells us that if we have for instance, if I'm an employer that has a high Gen Z population, you really need to look at a different application of your delivery of education services, because they're going to be interested, for instance, in incentives and even the gamification of components. So you can't universally apply, just because I need to educate people on this. You're going to have to think about how they're going to, want to learn. So again, how the learning is more important than the topics that you're teaching. Personalization was a critical component of this, and I would tell you that already, embracing decision support is a strong trend that helps facilitate that personalization, and we highly encourage that you help them, and that's really what decision support, and again, decision support takes a wide spectrum of everything from free calculators to web tools to personal telephonic interviews and so on and so forth. But bottom line is that this is a tool, an approach that's going to help them meet their own needs and goals, personalized to their life, help cut through the confusion, and is quite honestly, at least for this year, a potential solution for in-person benefits meetings. I think going to be really important because of what's going on in the pandemic, and traditional engagement methods are probably not going to be afforded to us this year. So just keep that in the back of your mind, and I'd consider you looking at some level of decision support. We talk about how we can help employees confidently save, and we saw the savings rate and the desire to save pretty consistent across the regions. And bottom line is, it didn't matter where you live in the United States, people are rarely saving for their future health care needs. So what's the employer objective? Let's get them to do something, right? We don't need them to have an epiphany and radically change their approach, but let's get them to do something. I'm going to cast how we talk about this as something near and dear to my own heart in our own business around HSA engagement, realizing that you can't have people go from A to Z without going through the steps. So regardless of what you're trying to engage them with, regardless of the topic, and again, I'm just using HSA for example here, you got to realize that you're not going to get them to do all those steps at once. So for instance, if I have an HSA, getting them to open the account and then start contributing and then build up enough balance to cover deductible and then cover an out-of-pocket maximum, and finally maybe feel comfortable to invest. that kind of stair-step approach is universally applicable to every component of your education and engagement strategy. So dissect the pieces, dissect the steps, and try and figure out how you can take them from one step to the next step to the next step. What's another action that you can do on this point is, quite honestly, there's some economic components, such as, if you have an HSA program, whether you're making seed contributions or match contributions, wellness incentives, or considering using a retirement reimbursement arrangement, but all of these fall into one category. They're economic drivers, and it's proven, well established, that there are no more powerful or consistent levers that an employer probably can pull to help increase their engagement than money, right? So whether you're considering bribing them to think and act differently or not, it's used in financial incentives to drive an outcome that's going to benefit both the employee and yourself. An idea on this that I want to make sure you guys understand, because it confounds me that this still remains one of the most overlooked and most powerful strategies to use this, is, for instance, using a matching contribution strategy within an HSA as opposed to a seed contribution strategy. So let me just walk you through, if you can imagine a scenario where, let's say, an employer wants to make a $1,000 contribution per employee. And in this contribution, you're putting $1,000 as a seed contribution. And let's say that the employee, so they get $1,000, let's say they spend $500 out of it and they save $500. Instead, if I could then actually move on to a scenario B, where again, I still want to have $1,000 as my contribution per employee, but instead I'm actually going to take $500, I'm going to split that $1,000, and I'm going to create a $500 seed and a $500 for match, and it doesn't matter if you want to match dollar for dollar or 50 cents, it doesn't make a difference, just follow the logic. It's still the same $1,000 of contribution by you, the employer, but simultaneously, if you're structuring it so that the employee has to make the contribution to get that $500, they're effectively putting an extra $500 into the account. Well, if they still have the same expenditures of $500 out of their pocket when the day is done, it's no further expense out of your coffer, but they would potentially carry an extra $500 in balance when the day is done. If you map this out over time, if, for instance, this is just looking at carrying over that $500 per year, and if it was just carried out over, let's say, for instance, 7 years, you'd end up with about $3,500 worth of cash. However, if I was to, again, just encourage the same investment on your part, and honestly, it's actually less investment, because anything that goes through you have to have a Section 125 cafeteria plan to facilitate payroll contributions for an HSA. But if you were to do that, anything that goes through the cafeteria plan would reduce your burden for payroll and FICA tax and so on and so forth. So arguably it would actually save you money. But let's just ignore that tax savings to you would exist. But if we were to look at the compounding of this over time, it would generate double the amount of money in that same time frame with no more investment by you. And the desire is there. This is actually a data stat that we took from the Willis Towers Watson survey a year ago, talking about whether or not employees would contribute to a matching structure in an HSA. And the majority of folks, 59% of people, said not only would they contribute, 59% of the people said they'd contribute more if they afforded that opportunity. So if you think about what kind of impact that would have, that even a modest increase there would generate a big impact over time. The last component here is just to want to think of it more of a public service announcement about preventative service, because we definitely saw, again, largely due to the pandemic, a lot of people are either not able to go after their preventative services or not tracking that. And 87% of consumers strongly agree or somewhat agree that their health insurance helps them plan and attain those medical services while managing healthcare costs, but we need to help nudge them and facilitate that. Some other things around coverage that you may want to think about, especially because of the pandemic, is whether or not you'd want to add telemedicine to help facilitate the utilization of services. If you have a healthcare FSA or HRA plan, are you going to make changes? Obviously, the CARES Act afforded opportunity to make some changes here. You want to think about, spend some time on these topics in Section 139 emergency accounts. Do you want to offer those things? Again, I could spend hours just on those topics. We don't have time today, but it's something to consider. One really important component, though, about this is, some key points of communication that you want to remember for this year is if you have, especially if you have a high FSA population, you want to communicate to those folks to address any unspent dollars that they would have because they maybe haven't had the ability to use those dollars because of the pandemic. And, obviously, if you're allowing plan election, changes or making plan level changes, so if you're either allowing or making those things, make sure to communicate properly. I know this is kind of stating the obvious, but we're finding a lot of employers are kind of overlooking these components right now. The last slide before we turn to our Q&A that I'll throw out there is getting a lot of questions these days, kind of thinking about, well, what does the crystal ball look like? And quite honestly, I don't have any more answers than anyone else, but I can tell that there are a couple observations that we've seen in our data, and I think these are going to continue in the future. Healthcare spending as a expenditure this year is definitely down, and it's down primarily because so many people, while yes, many people have been affected by expenses because of the treating coronavirus, the vast majority of Americans have not been able to utilize their and go for their typical healthcare services they would. That spending is starting to rebound as the country has reopened. So thinking about how that may impact plan design and considerations this year is important. We're also seeing early indications of a renewed strong interest in HSAs, and I think it's largely because a lot of employers realize that we're going to be facing some tough economic times for quite some period, as well as individuals are probably looking to stretch their healthcare dollars. And I think all of this, these trends are things that employers can capitalize on the interest in health and wealth. And hopefully, if you look at what we talked about today and take some of these insights into consideration, you'll realize that while yes, the pandemic has been terrible, is this affording us some opportunity to maybe capitalize on that interest and address some needs within the employee population. And so with that, I'm actually going to turn it back to our moderator for the Q&A section of our presentation. So Lynn, if you would like to take it away.
Thank you, Kevin. We do have some questions in the queue. So I'll give you the first one, which is, in my past, employers put together educational information on the employee's total rewards, breaking down information for health and wealth programs. Do you think that this approach is valuable?
That's a great question. I would say yes, it's absolutely valuable. However, I think it's not singularly valuable. In other words, if we're looking at the total rewards picture and saying, hey, this is the investment that we're making in you, Mr. or Ms. Employee, I think it's really important that they understand that, because after all, this, let's face it, benefits are expensive. It is absolutely an investment by employers. But that's just one part of the story, right? And I think what you have to identify, ask and answer for your own population, what are the 2 or 3 things that we need our employees to really understand, and pick those things as the topics you're going to try to address, and address those with very strong efforts. Everything else, while it's nice, it's important. I would say that if you try and do everything, it would be something akin to trying to boil the ocean, right? So absolutely important, absolutely valuable, definitely part of the narrative. But if that's the only thing you're talking about, it's going to leave a lot of confusion and a lot of missed opportunity on the table.
Great, thanks so much. What should employers keep in mind when it comes to providing pre-retirement education for employees on their health care options?
Yeah, so another great question. I know we've talked over the last couple of years on this topic a few different times, and I think the number one aspect when you're talking about pre-retirement education is understanding how much money it's going to take people in their retirement for healthcare. It's a shocking number. It's very surprising to a lot of folks. I've seen, again, a number of different sources that publish it every single year. I've seen numbers that range on an individual basis anywhere from $150,000 to $300,000 on an individual, and a family anywhere from 200 and something to more than $450,000 for a couple in their retirement, just for what they're going to need for their healthcare expenditures. Regardless of the actual number, it's a big number, and I think it's really surprising. And unfortunately, the way that we consume and educate about healthcare in our country seems to still revolve around the notion of open enrollment, right? And when you're trying to get people to engage and think and take action about their health and wealth, trying to fit that into a narrow window of time is very difficult to get them to focus on anything other than the next 12 months. So the most important aspect is understanding the need, and then take action. Do something. You're not going to solve you're not going to eat the elephant all at once. You're going to eat it one bite at a time. And if you want to make action, do something to get them started, because something is better than nothing. And getting them to understand the issue and take action is really the most important component.
Great. The next question is, how can we push the investing aspect of HSAs to our employees as an extra income incentive in saving for healthcare expenses?
Yeah, I think part of it is in the answer I just gave about understanding the number, because reality is you are not going to be able to build a retirement nest egg sufficient enough to cover that healthcare cost. For instance, whether you're using HSA or if you're not using a tax-qualified vehicle and you're just making a savings account separately, you can't get there with just contribution alone. To fully cover those things, you're probably going to have to use the time value of money and investment returns. And, again, one of the, we have definitely seen trends where people are finally, they're building up enough balances, getting enough comfort with the concepts of HSAs and consumer-directed healthcare, and thinking about retirement enough where they're starting to invest. And I think we, as educators and engagers of the population, have to take that as part of our responsibility to, again, identify the need, inform the people of options, and hopefully encourage them to start to take action. And I think if you do that, you'll find more and more people building up the confidence to start investing and start doing that, and hopefully addressing that shortfall on their retirement need.
I think we have time for one more question, and let's take this one. What trends are you seeing or anticipate seeing for healthcare enrollment this year?
The crystal ball. I would tell you, I have seen, again, I've been involved deeply in benefits and employee benefits here for about almost 25 years, or about 25 years. This is definitely an interesting one, because if you would have asked me that question even a month or two ago, I probably would have had a different answer, because we've seen some pretty radical shifts in we'll just say business trend in our core business. What we saw early on was a lot of employers were stuck in neutral. I called it the great pause, and it was quite honestly because of the unknown, right? They didn't know what the pandemic was going to be, and what was furloughs and layoffs and all these different components, and how it was going to impact their business. Well, as we're start to get back into some semblance of normalcy, I think what we're seeing is, some sectors of business are dramatically impacted. So if you're restaurant or hospitality or those types of things, airlines, travel, hotels, definitely, they probably have a radically different reality than, let's say, for instance, somebody in technology or professional services that has, transitioned maybe their workforce to be remote and maybe be less impacted there. So I think what we're starting to see is while early on people were stuck in neutral, I think now in just the last 6 to 8 weeks, we've seen a lot of employers, even large employers that would not make changes to their structure so late in the year, really starting to think about, we need to make some change. And I definitely seeing an upswell of interest around consumer-directed healthcare. And we're even seeing some large employers that had even still up until now been on the fence for CDH, trying to make some moves there. I think that trend is going to continue. Again, it's probably too late to make radical changes for 1/1 for this year, but I'm definitely seeing interest for that in next year as well. And I also think you're going to see fairly flat increases on premium increases, both within the insured population and ASO. The reason I see that is, quite honestly, just like you saw a lot of property and casualty insurers returning premium because of the utilization was down on car accidents because people weren't driving. I think you're going to see fairly flat increases, at least on average, in the healthcare space. However, there's still an awful lot of unknown answers around the expenses associated with the pandemic and that. So I think a lot of that is the focus is going to be on the economic trend rather than the healthcare expenditure trend, but I definitely see a lot of interest in CDH.
Great. Well, thanks very much for reading those tea leaves. And thank you very much in the audience. I'm sorry, I'm talking over you. Go ahead.
Oh, no, absolutely. I knew we were getting to the wrap up here, and I know you're going to close out for us, Lynn. And again, I just wanted to remind the audience, if you haven't done it yourself, to go and take the Health and Wealth Index Calculator tool for yourself. It is free. It is publicly accessible. You don't have to be a client of ours. I encourage you to do so you know your own score. And of course, you can download the full index of white paper at this URL. And if you have any other questions, and that, of course, my contact information is on the screen. I just want to say thank you to Lynn and EBA-EBN. I'll turn it back over to you, Lynn, to close us out. But again, I really appreciate your time today.
Thank you very much, Kevin. That does conclude our seminar. I'd like to thank everyone in the audience for joining us today for the webcast. We hope you found it valuable. And a special thank you to HSA Bank for sponsoring the event. If you missed any part of the presentation, you'll be able to listen to a recorded version within 48 hours on the EBN and EBA websites. We'll also be sending you an email with a link to the recording. We appreciate you being with us, and have a great rest of your day.